Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top news. A 31-year-old woman with recurrent episodes of autoimmune encephalitis was successfully treated. Rare case of a 31-year-old woman from Mira Road who presented with right-sided twisting movements of her hands in July 2023. Initially misdiagnosed as a stroke, her condition was later identified as autoimmune encephalitis, a rare inflammatory disorder affecting the brain. This condition, often mistaken for psychiatric issues, can lead to detrimental outcomes if not promptly diagnosed and treated. Fortunately, under Dr. Pawan Pai, a consultant interventional neurologist at Wokhard Hospital's Mira Road, she received the appropriate diagnosis and treatment, leading to a remarkable recovery. To talk about this case in detail, we have with us today Dr. Pawan Pai, a consultant interventional neurologist at Wokhard Hospital, Mira Road, Mumbai. Welcome to Medical Dialogues, Doctor. So, Doctor, can you tell us about the case history?
Yes. So this is a case of a 31-year-old woman. She's a housewife staying in the Mirabai area. So she initially presented to me in the month of July 2023 with sudden onset of right side upper limb and face twisting movements, which was earlier she went to other neurologist. Initially, she was treated like a stroke, and her MRI, which was an outside, showed few changes which are suggestive of stroke, of course, on the left side of the brain in the basal ganglia region. So, like she went to two other doctors, which and was on the treatment for stroke. Yet she was getting those involuntary twisting movements of the hand. So then this patient came to me in an emergency. So when I took the history in detail, apart from those twisting movements, there is a history where 1 month prior to these events, she had a viral infection, and after that, she started getting some behavioral changes in form of a lot of anger outbursts and kind of depression. And she was never like this before. So this was something different, which was already in the background. Apart from this, like in 1 week, she was getting this twisting movement of the hand and face. So on clinical examination, there was nothing contributory. But when you saw when there was this history of fever followed by these events with behavioral changes, these involuntary twisting movements of hand and legs, hand on the right, was suggestive of something called as faciobrachial dystonic seizure, and this was something not in sync with routine stroke-like symptoms. So I discussed her outside the MRI, which was done outside with our radiologist in house, Dr. Pradnya. So she gave a clear cut picture that this could be autoimmune encephalitis, which is a very rare entity, usually occurs in younger women in the age group of 20 to 40 years. And with her kind of inputs and my clinical diagnosis, I was in favor of autoimmune encephalitis, which was a quite, I would say, a daring decision to take, because patient then will be subjected to higher investigations like doing a lumbar puncture and all these things. So we convinced the relatives, and they also were agreeing for this. So we did her CSF test and we sent it for the analysis. So in that, we got to know that her NMDA receptor antibody was positive. So it was fitting into something called as NMDA receptor encephalitis. So once we had this diagnosis in hand, the treatment for this is IVIG, which is IV immunoglobulin. So we started her on IV immunoglobulin for a period of 5 days. During the period of treatment, she was completely free from symptoms, and even her mental changes, which were there, so had come to a acceptable level. So basically, she was started on treatment like to prevent seizures, anti-epileptic. So all these things were started, and the patient was discharged, and she was told to follow up on OPD basis. Now, what happened? She came to me once. Thereafter, she didn't turn up, and when we like for last 6 months, that is from August till January, she didn't turn up. And meanwhile, when she came back in the month of January, mid January or third week of January. So she again came back with new onset of symptoms. That time she told me ki she had become pregnant in the month of August. This was her second pregnancy, and she thought she was all right, and she had stopped taking the medicines which were prescribed. But unfortunately, in the month of December, she had a miscarriage, and then she had a bit of depression because of miscarriage, which she thought was a usual kind of a situation. But this was getting out of proportion to uh, what you can see the kind of grief because of the miscarriage.
Right. So, what were the complications you faced during this procedure?
Yeah. So this was again she was getting into a situation where again she was getting anger outbursts. Again she was behaving very weirdly. So something was not correct. She could notice that, and it was not correlating with the grief of miscarriage, which usually one may get. So basically, now she started getting different kind of symptoms. Like earlier, she was getting this twisting movements of hands. Now she started getting periods of speech arrest. Means when she was speaking, suddenly she would stop speaking and she would not recollect what to speak. And she was getting intermittent periods of imbalance. Like chalte chalte in between, she used to suddenly have imbalance and sometimes even close to getting a fall, and she would hold on to something to prevent a fall. So this was something very different from what she had faced in the month of July 23. So this time the feature, and we got another MRI done. She, before coming to me, she got another MRI done, which now showed that there were some demyelinating plaques. Means whatever was seen on the MRI earlier in July, now again we have some new lesions, but the kind of enhancement which was seen in the previous MRI was not seen now. Means the features of autoimmune encephalitis were not glaring, but there were features of demyelination which were now seen on the present MRI. So basically, she got again admitted in the my care, and we again repeated a CSF. She was not very keen on repeating a CSF. She was like trying to maybe delay it, but I said no, we should do it. So we got it done, and this time we sent her investigation to another institute, that is Amrita Institute in Kochi, for a kind of second opinion of a pathological diagnosis, in which again her NMDA receptor antibody came weak positive, and her CSF also showed oligoclonal bands, which are suggestive of multiple sclerosis in which we get it. So oligoclonal band were also positive. So we admitted her. We gave like Solomedrol. We gave a higher form of steroid this time, 1 gram per day for 3 days. So she started improving. We wanted her to get one whole body PET CT done. In the previous admission, we had done just a CT scan of her abdomen to look for something called as ovarian teratoma, which is a common condition wherein we get NMDA receptor antibody encephalitis, which was negative that time. This time we said we'll get a PET scan done. In the waiting period of PET scan, she had not taken oral steroid because sometimes PET scan can be obscured because of the steroid. So in that 1 week, again she started getting those symptoms like speech arrest, imbalance while walking. So we said, "Ki you hold on to PET scan," and we started her on steroid. Oral steroid over continued. Once she was on oral steroid, along with uh, this one, like oral steroids, anti-epileptic. So she became all right again. These involuntary events stopped. Her mood changes also improved. So we decided to give her IV rituximab, which is a immunosuppressant to prevent relapses of these events. So she was given IV rituximab twice in the interval of 2 weeks. We had our immunologist, Dr. Preeti Nagnur, for this.
So, what are the prognosis, doctor? Is the patient well now?
Currently, patient is stable. Like we are now in the month of May, which is almost 2 months from February. She had come to me for follow-up twice in between, once in the month of February and once in the month of March. So right now she's not getting these events at all. She's on a very low dose of steroid and continuing with the medical management only. Right now, is carrying out all her activities. Even her behavioral changes are no longer seen. So basically, here there are two important components. One is the early diagnosis. Second issue is of compliance. If patient had been compliant, maybe she wouldn't have had a relapse. And now that she had a relapse, we treated her in a like with a higher immunosuppression, with which she is now better. So basically, this is called as autoimmune encephalitis. Here, in her case, it was NMDA receptor associated encephalitis, along with demyelination, which is a very rare condition in itself. Like when we don't have this ovarian teratomas, there is in the literature a mention that when you have encephalitis, it is very rare to have demyelination as well. Sometimes there can be a other antibodies which can come positive, like NMO antibody or MOG antibody, also positive in very select few cases. So it is the rarest of the condition to have both the situations together. However, with adequate medical management, patient is taken care of, and she is no longer getting any relapses.
Right. Thank you so much, Doctor, for your insight and for being here today on Medical Dialogues. The case was managed extremely well with tremendous efficiency and expertise of Dr. Pawan and his team. Salute for giving new lease of life to the patient. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.